phones and videos off, just to try and have activity. Thank you. Welcome to this virtual meeting of Post Tyneside Council's Overview, Scrutiny and Policy Development Committee. Following the introduction of regulations to allow remote meetings in the light of current corona pandemic, how we are meeting this evening. My name is Councillor Sandra Graham and I'm chair of this committee. I would like to inform everyone that this meeting is being live streamed on the Council's YouTube channel to enable the public to observe the proceedings, and I welcome anyone who's watching from home. So welcome to this meeting. Before we move on to the agenda, I would like to make it clear who is participating in the meeting and explain how we intend the meeting will be conducted. In order to check who's at the meeting, I would ask everyone present to confirm their attendance. So first I will call out the names of each committee member, and after I call your name in alphabetical order, please turn on your microphone and camera and introduce yourself. So we start with Councillor Jim Allen.
Hello, this is Councillor Jim Allen calling.
Thank you, Jim. If members could turn the camera on when they introduce themselves.
Oh, you want me camera on? Sorry.
That's all right.
Councillor, the rest.
Thank you. Councillor Alison Austin.
Councillor Alison's prior apologies in chair.
Thank you. Councillor Brian Burdis.
I'm here. Well,
Still logged in twice, Brian.
Right, I'll try and get the other one.
Councillor Karen Clark. Councillor Muriel Green.
I'm here, present and correct. Thank you very much. Councillor for Wheatslade Ward.
Councillor Janet Hunter.
And I'm nearly here. I'm here.
Thank you.
From the south.
Thank you. Councillor Andy Newman. We'll move on to Councillor Pat Oliver.
Councillor Oliver's apologies in as well, chair.
Thank you. Councillor Martin Ryan. Councillor Debbie Cox. Councillor Joe Kerwin.
Yeah, I can confirm that I'm here.
Thank you. And Councillor Les Miller.
Yeah, I'm here, Chair.
Thank you. And Councillor Willie Samuel.
Present and correct. Thank you.
And do we have any of the other representatives with us tonight here, Paul? We have
Yes,
Mrs.
Ord is here, I believe.
Hello, yes, I'm here. It's Michelle Ord here. I can hear everything.
Thank you very much. Reverend Michael Vine.
It doesn't look like Reverend Vine's in attendance, chair.
Mr. Stephen Fallon.
And again, it doesn't look like Mr. Fallon's in attendance.
Thank you. And can I now ask the officers in attendance to introduce yourselves, stating your name and your role within the council. After I call your name, please turn on your microphone and camera and introduce yourself. Phil Scott.
Good evening, Chair. Hi, I'm Phil Scott. I'm the Head of Environment, Housing and Leisure for North Tyneside Council.
Thank you. Jackie Old.
Doesn't look like Jackie Old's in attendance, chair.
Wendy Berg.
Good evening, Chair. Wendy Burke, Director of Public Health.
Thank you, Wendy. I know we have apologies from Janice Gillespie. Bryn Roberts.
Bryn Roberts isn't in attendance, chair.
Thank you. Jackie Lawton.
And same again, chair.
Claire Emerson.
And again, chair.
David Dunford.
Good evening, Chair. David Dunford, Senior Business Partner for the Finance Team.
Thank you very much, David. Colin MacDonald.
Good evening, Chair. Colin MacDonald. I'm the Senior Manager for Technical and Regulatory Services.
Thank you, Colin. Margie Burdis.
Good evening, Chair. Margie Burdis. I'm the Partnership Director for Capita.
Thank you. Paul Wheeler.
Chair, I'm in attendance.
Thank you. Joanne Holmes?
Yes, I'm in attendance.
Thank you, Joanne. Councillor Bruce Pickard?
Hello, Chair. Yes, I'm in attendance. Deputy Mayor here for some of the issues on the agenda.
Thank you very much. Is anybody in the meeting that I haven't called your name or?
Yeah, yes, Chair. It's Mark Longstaff, Head of Commission and Asset Management.
Sorry, Mark, I've missed you off.
That's okay. It happens.
Apologies, I could never miss you. Thank you. And for today's meeting, we must first of all deal with some formalities. Any further apologies for absence, Paul?
Yes, Chair. There's the 3 councillors that have put in their apologies is Councillor Austin, Councillor McMullen and Councillor Oliver.
Thank you. And can I remind to declare any registrable or non-registrable interests in matters appearing on the agenda and the nature of that interest, or to disclose any dispensation in relation to any registrable and or non-registrable interests that have been granted to you in respect of any matters appearing on the agenda. I don't know how to fill in the form, Paul, but I'm sure we can do that by electronically if people need to. So if people need to declare that, please do so. The agenda papers contain 3 reports, and I'll take each of the reports in turn in the order they appear on the agenda, which has been published on the Council's website. For each of the reports, I will ask a relevant officer to introduce the item and then ask members of the committee if they have any questions and ask any members if they wish to make any comments on the reports. And once the item is ended, if the officers wish to leave the meeting, they're very free to do so. So don't feel you've got to stay for the whole of the meeting. And could I ask people to mute their microphone and turn off their video unless they are speaking. So could I just as well go through some background information, because we have already met, even though it's been a very long time since we met physically. We have met with the chairs and deputies of all of the scrutiny committees to try and work out some work programmes, because even though we're in the COVID-19 situation, the need for scrutiny is as great as ever, and we should be continuing. This committee, the ONS committee and the finance subcommittee, will be scrutiny committees that will continue to meet in a formal way, even though it's virtually. The finance subcommittee met on the 14th of July. The other subcommittees will meet to continue to do their work by holding meetings informally. And a quick update is that Adult Social Care, Health and Wellbeing met on the 21st of July and will receive further briefing papers on areas they've identified for further consideration. Children Education and Skills Subcommittee, the Chair has met with the Cabinet member and the key officer with an informal meeting to be arranged to take place in September, with a briefing on the overview of the Council's response to the pandemic in children's services, child protection and early help services, and the challenges and long-term implications and the Council's roles in supporting schools, the returning to school strategy and plans for the immediate future and long-term future for education in North Tyneside. Culture and Leisure have received update briefings on the reopening proposals for indoor sport and leisure facilities, customer first centres, libraries, arts, museum and heritage facilities. Economic Prosperity Subcommittee, the chairs met with the lead officer and an informal meeting of the subcommittee is to be held on the 8th of September to receive an overview of our economy theme, the recovery plan, and to consider a work programme arising from that. Environment Subcommittee, we're still waiting response from the chair on that, and Housing Subcommittee, a meeting is to be held in September to receive a further briefing. Prior to that, an informal discussion will be held with the chair and subcommittee members to discuss members' expectations and to confirm the work programme that will be focused on our recovery plan. It is planned to produce a report to overview Scrutiny and Policy Development Committee once the subcommittees have met to consider their work programme. So that gives you a bit of a flavour. And obviously North of Tyne and NECA have been meeting virtually as well throughout the lockdown. So if we move on to the formal agenda, can I say, do we have any substitute members, Paul? I didn't think we did.
There's no substitute members, Chair.
Thank you. And can I ask that the minutes of the last meeting held on the 2nd of March 2020 be approved as a correct record?
Agreed.
Agreed.
Thank you, members. And can we move to item 5, which is COVID recovery framework and progress in North Tyneside? We have this paper, and Phil Scott has also some additional presentation to add to this paper. I know you will have all read them very carefully, and I will pass over to Phil to outline our council's response to COVID. We have had briefings, but it's nice to receive things formally. Thank you.
Brilliant. Thank you very much, Chair. I'm hoping somebody's going to put the presentation on the screen and they're not relying on me to do that.
I'll just take 2 seconds and I'll put your presentation up.
You're a good one. This is, you have a report, but we've got a presentation to hopefully give you a good feel for how the framework, how the recovery framework's kind of progressing, and some highlights in terms of kind of the work to date. So as I am conscious, obviously, that members are already receiving quite a bit of information in terms of our response and recovery activity. But hopefully, like you say, a formal overview of what's going on and an opportunity to kind of ask me anything, and I'll try my hardest to answer as we go. If you can go now straight to slide 2. Paul.
Yep, 2 seconds. It's there.
There you go. There you go. Lovely. So, as I'm sure you're aware, that we kind of originally were in a crisis phase dealing with the pandemic. We decided that actually we kind of we move out of that phase into a recovery phase. We took the framework in terms of a structured recovery plan through a cabinet approved this on in late June. Its purpose was to set out actually how we will work, how we'll take all of the challenges that lie ahead in a more structured way, moving away from the crisis response to recovery phase, thinking about how we kind of involve elected members for greatly, how do we rebuild the council in light of kind of COVID. And actually, there'll be kind of like a 3-stage response to this. The report gives you further detail, and there's a number of work streams that we've decided would be required for us to kind of to respond to COVID-19 and start restarting the council, so to speak. I think it's important, next slide please, Paul, is that we have a strategic context to all of the work we do. You know, the Mayor and Cabinet, you have produced a council plan. There are very strong themes in there: the people, places, economy. We you know, our badge says we serve. We have a customer program. We have ambition for the borough. We have medium-term financial plans. There is an awful lot of outward-facing kind of policy priorities for the council that's already been approved by Cabinet. Cabinet also see how the organisation are managed. So things like we have a set of values. We kind of know we have a whole raft of kind of work around the technology to support the organisation, and as plans in terms of how we kind of manage and look after our teams and our resources. So I think what you've got there is actually there is a real strategic context to everything we do within the borough, and actually there was no reason why we shouldn't really kind of look back to those strategic objectives and policy priorities and everything we're doing in terms of the recovery plan as well. Next slide, please. In terms of organisational values, on the next slide, Paul, thanks. As we listen, we care, we're ambitious, and we're value for money. So actually, we'll listen to our businesses, our residents, our staff, our community and voluntary sector. The health and safety of our teams is of paramount importance, and you know it's a strong value throughout our customer service programme. We're ambitious. We're a small metropolitan borough, but everybody knows we box above our weight. We kind of have really kind of ambitious plans for the regeneration of the borough and everything we do. And actually, we need to keep tight financial control on everything we do. Those values absolutely apply to our recovery plan as well. Next slide, please. I thought it would be interesting to go back, and when we took the recovery plan to June, actually we made some planning assumptions in there that actually looking at a recovery plan for North Tyneside, we came up with some planning assumptions that we had to start thinking about early doors. So we knew for a fact we'd have to live with a virus in the community for quite some time. We knew the government would look at further easements of lockdown and try and restart the economy. We thought that would be gradual and would have to respond to that. Test, track and trace, which I always find difficult to say, and I've managed this time. We knew they would slow the spread of the virus and we would have a role to play. And that's certainly come to fruition. I'll talk a little bit about that later. Shielding the most medically vulnerable would remain for some time, and the Mayor and Cabinet were very keen that, regardless what central government was saying, that we identified an awful lot of vulnerable people that required support, that when the government support was withdrawn, that they wouldn't face a cliff edge in North Tyneside. So we'd have to give some thought to what we did about that. We knew the authority would start to see a changing demand for services. So things like adult social care, children's services, we are starting to see that now, and that would become a big issue for us. Social distancing and good hygiene will be key for quite some time. PPE would be required, and we had a feeling that maybe some of the legislation around that would change and government guidance would change, so we had to keep an eye on that. And probably the two very, very important ones, we knew this was going to have a significant financial impact for the authority. This is going to cost us money, and also the economic impact for the whole borough would be substantial. Next slide, please.
Just a slight pause.
Yeah. Cheers, Paul. The recovery plan, so our structured approach, we thought would be in 3 phases. So really off the slide to the left is that we were in response phase when we were looking at this, and that was just our immediate reaction to get folk working from home. We need to keep everybody safe. In the recovery phase, you start to think about, right, how do we kind of restart and putting in arrangements to start bringing services back online. Very, very important for us as a local authority was to try and make sure we had political oversight of what was happening. So we had to put in the arrangements for the things that Councillor Graham touched on at the start, sort of the virtual meetings, virtual cabinets, all of that kind of stuff, to try and make sure we were far more getting back into a normal way of working. And you could see that clear link from kind of cabinet and council policy direction to everything we're doing. We're coming to the end of that phase at the end of September, move into October and March, where actually it's a kind of slightly different feel. It's really kind of looking at more long-term transition, because we don't think, obviously, we're going to be virus-free by then, but we're going to have to be absolutely living with the virus. And how do we bring in smarter controls to kind of get the economy going and our recovery plans for North Tyneside more fit for purpose? And actually, there's a big thing for us in terms of kind of planning for winter now. How does COVID sit alongside kind of the winter plans of the NHS and flu and all that kind of stuff? So it's a different challenge for us. We think that's going to last for quite some time, getting all of that right. And then come April to July, our focus will be very much on, we think there'll be a slightly different landscape out there in terms of the businesses that are in North Tyneside, and we still are an ambitious borough, and we'll want to pick up those plans and recreate a strong economy, looking at the future of North Tyneside and how all of that works in a new world, really, and how that all works with kind of public transport. And I'll touch on some of that in the next couple of slides. Next slide, please, Paul. I'll not run through every bullet point, but our recovery objectives follow the themes in the council plan. So our places, our people and our economy, and obviously we had to worry about the organisation as well. So I'm hoping you can start to see that clear link of all of our recovery activity is very much aligned to your policy priorities. Our objectives very much as a borough, as officers and members, providing calm leadership. I keep hearing Norma say, you know, we need to be you need to give people hope that there is an end and we can manage this. Obviously, we need to protect the vulnerable as a priority. We need to contain the spread of the infection. We'll have a key role to play in that. And obviously, health and safety of our staff, residents, visitors is paramount. There's some highlights there. In terms of our places, you've probably seen, you know, lots of things change with signage and changing the public realm and kind of how that's managed. But we need to ensure that we were creating as COVID secure open spaces as we possibly could. We certainly wanted to kind of ensure North Tyneside remain a great place to live, work and visit, and that our town centres could still thrive in these challenging times. Our economy we are a business friendly borough, and this is really a high risk area in terms of how businesses can survive this. So we wanted activity to support our local businesses and making sure that we were focused on economic growth. When the time's right in our organisation, I've touched on, we wanted to ensure there was clear democratic oversight. We follow national guidance, and sometimes I do hear some people say, why are we doing that? That's very important, and just in terms of any kind of future challenge to our decisions, actually the fact that we are following national government guidance is really important. Reflecting the current context in North Tyneside through evidence-based decision making, we are absolutely keeping a close watch on infection rates within North Tyneside, identifying where there's potential hot spots in terms of outbreaks, trying to be proactive with businesses and in managing risk, etc. And to continue evaluate as we go. We've had about 3 stops now to kind of say, right, and what's gone well, what will be even better with, because this isn't an off-the-shelf kind of solution. This is very much us responding to new challenges every day, and evaluating our response to that and kind of learning lessons as we go is really important. There are a number of cross-cutting themes in the recovery objectives, things like public health, finance and the likes of, and they kind of cut across most of the themes. Each of those themes have specific work streams with plans for specific recovery. And I'll touch on just some of the highlights within there. There is lots and lots, and like I say, I know for a fact you get lots and lots of information on this anyway, and you receive your regular cabinet member briefs. You get the all member briefs, and I know cabinet share a regular update with you all. But just to give you some of the highlights from the recovery activity and the people theme, we invented a local system support hub to help those people that were identified as kind of needing support and vulnerable. So we invented, through displaced employees who couldn't work on their normal jobs, a support hub that supported around 1,400 people. We've worked really close with our care homes in terms of, and I've heard criticism from other parts of the country of care homes just being kind of left to get on with things. That certainly hasn't been the position in North Tyneside. We supplied them with their PPE. Actually, we ended up being the PPE distribution service for the whole of the Northumbria LRF area. As the government system wasn't quite working. So we took that on board, and that was making sure the likes of our care homes were getting proper supplies of PPE in a timely fashion. But also we were taking the government deliveries for the whole of the region, Sunderland, Gateshead, South Tyneside, North Tyneside, Northumberland. Right now, there's obviously and Wendy will probably be able to give you chapter and verse on this, real intensive support right now for planning for the full return of schools in September, and a massive kind of responsibility for us is to have the right plans in place should we have to deal with local outbreaks of COVID-19. And I think I'm right in saying, well, certainly in my opinion, we're well positioned now when I look at how some other folk are kind of preparing for this, in terms of actually we have got a local outbreak plan, we have designated officers in place, we've already identified kind of high risk areas and businesses, and we're working with them before there's outbreaks, and we've already tested exactly what we will do should we experience an outbreak. So an awful lot of work going on in preparation of something that I hope we'll never use. Next slide is just in terms of our places. Some things we've put in place, actually, a lot of people asking that we retain them forever now. Things like households at the appointments at the household waste recycling centre, which absolutely just manages social distancing responsibilities really, really well, and has taken out an awful lot of improper use at the site. We've opened all of our place sites. I know we were first in the region to do that with the right restrictions and guidance, working closely with public health on that. It's a dedicated cycle along the seafront. We've changed lots of areas of kind of high risk. So you'll have seen what I think we all remember at the outbreak in March and April, in the early days, the weather was absolutely fantastic, and our beaches were inundated with visitors, and it was in terms of risk, was seen as a really, really high risk area with cyclists and pedestrians sharing space. So we, in response to kind of the government asking us to do something about that, we've changed the use of some of our public spaces quite substantially. So Parkview became pedestrianised, bits of North Shields, Wallsend High Street, and like I say, the seafront. So there's been an awful lot of work to try and manage the health and safety of our visitors, along with supporting our businesses in terms of making sure that people could still shop as well as visit some of our kind of tourist hotspots. One thing I will say is our joint working with Northumbria Police, we have had some real challenges in terms of we are very, very popular, particularly on the seafront, as a visitor destination, and that brings with it some real challenges. But I'm pleased to say our partnership working with Northumbria Police now is in a far better place. And so the weather forecast for the weekend's great. My team have already met with Northumbria Police early in the week, talking about how we kind of proactively manage some of the challenges along the seafront now. And you've probably seen the reopening of a lot of our leisure centres. The gyms have opened, swimming soon. Our customer first centres are open to click and collect services. Will be opening up wider. Some browse time around the libraries. Will be going live with exercise classes. Cabinet were very, very keen that we looked at some kind of events program, obviously focused on outdoor events at the back end of the summer. And I'm pleased to say things like the Kite Festival will happen this year. We are putting on some cinema in the park, and there's an event activity. So there are things to do in North Tyneside as well, even though it's quite a challenge to arrange those in a way that's safe and secure. But we found a solution. Next slide we put in terms of our economy. We know for a fact the number of people claiming universal credit is increasing quite substantially, and we're working with the Department of Work and Pensions and Department of Education in terms of plans for jobs programme. We've processed millions of pounds worth of business support grants. They've all been issued. We're working with a small number now who haven't claimed, and we're proactively knocking on their doors, asking why and can we help them in any way. And like I've referred to earlier, we've pedestrianised some of our shopping areas and hospitality destinations just to make sure that actually people are still visiting our small businesses and shops. We're now dealing with the planning and licensing, what says bill that's now actually an act. Parliament have passed that, which is giving new freedoms to licensees and quick planning processes for those businesses who would like to spill out onto the public realm. And that's quite a lot of work behind it, but we're doing everything we can to make sure that actually we're supporting local businesses as much as possible to ensure that they can survive these challenging times. In terms of our organisation, the fact that we're here doing a virtual overview and scrutiny committee, there's virtual cabinet committees. You've talked about your subcommittees of overview and scrutiny. We're heading towards full council in a virtual setting in September, and I hope you've seen that as from all of the different cabinet members' briefings and the stuff that cabinet sharing as well, that political oversight and democratic oversight is very firmly in place, although it feels a little strange and sometimes it's remote. Finance is obviously a real challenge for us. This is costing a lot of money, but the government are providing some support and trying to kind of get that to a position where we can predict what impact this is going to have on this financial year and actually on future financial years as well. There are concerns that we might not get the footfall in some of our activities, particularly those that have heavily relying on income. Whilst restrictions may be lifted, whether everything returns to the same level it did before COVID remains to be seen yet. And there's an awful lot of work that's gone on to support individuals and teams to not only work from home, but actually most of the activity right now is trying to get the workplaces ready for a return to work. And now that won't be in the short term a return to what was there pre-COVID, but making sure that all of our workplaces and buildings are as COVID secure as possible. And that has been a phenomenal amount of work. So just to summarise kind of all of that activity, there's a recovery coordinating group. It kind of coordinates all of that, reports through the cabinet on a weekly basis. The recovery coordinating group is chaired by myself and Jackie Lawton, but has key people on like Jackie Old, the head of adult social care and children's. It has a director of public health on. So we're keeping a real close eye on all of the recovery activity across the borough. We've trying to kind of keep a handle on the changes from government on a daily basis is a challenge, but we have oversight and we try to. Well, we ensure that all our activities are in accordance with the latest government guidance and legislation. We've got a good dashboard of data that comes in that looks at our staff. It looks at businesses in terms of health checks, in terms of who's not paying their business rates, who's struggling. It keeps a close look at the infection rates within North Tyneside, and that's reviewed on a weekly basis in RCG. We've established a very, very clear protocol for services returning. We've individually risk assessed every employee in North Tyneside now. Those who have worked throughout the pandemic and those who are thinking about returning to work now, to make sure that actually we're not asking people to come back into an environment that that's not suitable. And that's, again, something that if you think about the number of employees we have, what an undertaking that was. And in terms of key metrics, that's just we have a set of facts and figures. It gives us a good health check. It also we work closely with our partners in terms of NG and Capita as well, and with our trade union colleagues in terms of kind of health checks on our workforce and how that's going as well. We've now got some programme support in place. We know this is a real big challenge for us. This is kind of re-establishing, redesigning the council to live alongside Coburn at the moment. It has to be managed as a kind of a sensible programme. We're conscious that you know, there may be kind of challenge on decisions in 2 or 3 years' time for people. We'll have to have the right documentation archived in the right way and evidenced that we've made the right decisions at the right time based on the government guidance, etc. So if you start to think about the number of decisions we're having to make, even just to open up a library or a gym, we've put some dedicated support in there to make sure that actually our management arrangements and decision-making arrangements are as robust as they will need to be. And right now we're kind of ending the first phase of recovery, and there will be a formal review of that to see kind of how we did against the milestones we set, etc., and start to agree what are the milestones for phase 2. So quite a bit of activity. It would be really difficult to kind of to go through the specifics of every service that's restarted in some way, but I hope that gives overview and scrutiny some oversight of this is how we've approached the recovery plan, how it links into your policy and priorities and ambitions, and kind of just some of the highlights of some of the work that's been undertaken on what feels very much still the beginning of the journey. And I'm happy to take any questions. I think you're on mute, Councillor Grimm.
Yeah. You're on mute, Sandra. Switch on.
Actually, no, your mute sign's gone, but we can't hear you, Sandra.
All right, lovely.
Yeah.
Oh, no, you're back.
Am I back? Right,
yes.
I'll take my earplugs out, maybe that's it. I'll take my earplugs off. Thank you for that very much indeed. I've got a few questions on track and trace, because I think that's a key area to allow us to get back to some kind of new normal. And I'm not sure how this operates within the borough. I know in a setting that I'm working in, as people come to a mass, we're taking people's contact details and things like that, but I'm just wondering what happens, you know, just a scenario, maybe Wendy can tell us what happens if somebody is identified and how we get in touch with more than 72% or wherever, however the figure is at the moment.
I am so pleased Wendy's on the call.
And also about visits to care homes. I see that Wendy has written to all care home owners, give them notice that she approves the opening of them. But what happens if the care homes say no? I know there's a lot of very unhappy, isolated, demented people out there who are desperate to see their family, and just wondering how that's going to be managed in the medium term. And part of this formal review, are there any plans to feed in any members' experiences that we've had, you know, interacting with our constituents, that how things have gone? There's certain things in Whitley Bay that I would be certain that I would be wanting to feed through.
Okay.
Well, I'll take those first 2 points, Chair, and then I'll hand over to Phil for the third point about experiences. So in terms of track and trace, basically how the system works is that every confirmed case of COVID-19, so basically that's confirmed through the laboratory, so you go for your test, you have your swab. If it's a confirmed case, that is notified straight away to the test and trace system. So it's an automatic referral. It's all done electronically. The test and trace system will pick that up. The tier 3, the lowest level call handler, will initially pick that up. And the person will either get an email or a phone call, and they will then have a chat with that person about where they work, where they've been, who their contacts are, as well as being given advice to self-isolate for 10 days. If that person is working in a complex setting or a high-risk area, basically that case would automatically be escalated to the tier 1 person in the test and trace system. The tier 1 person is sitting in our Public Health England health protection team. So if it was a care home, if it was a school, if it was a food processing plant, if it was a large pub, a large workplace, any high risk setting like that, our health protection team would be notified and they would tell me straight away. Our health protection team would then do all of the contact tracing, would follow up the contacts, and they would be given specific advice on self-isolating for 14 days. If it's a relatively straightforward case and run of the mill, then the tier 3 and the tier 2 people are NHS professionals, would deal with that between them. In a nutshell, our cases at the minute in North Tyneside, we've got an 85% completion rate on the follow-up of every confirmed case. And for our contacts, we've got an 87% completion follow-up rate on the contacts. The bulk of those, I would say probably about 60%, are being picked up by our health protection colleagues in Newcastle, sitting in the Public Health England team. Their completion rate for the 60% that they pick up is 100%. So actually, the more cases that get escalated to Public Health England, the better. We're looking at that in the region, though, because even though we're doing really well in the North East, and that's largely because we work very differently as a group, and we work very differently with our colleagues in Public Health England to what they do in any other region, we are still looking at the proportion that are not being completed because we think we can do better, and we're busy trying to come up with a better integrated system that will mean that we get 100% completion for everybody. That's our aim, but that's how it works. The other way that people might get notified is, for example, we had a small outbreak in a school before they broke up for the summer holidays, and actually we knew about the 2 positive cases before it got through to test and trace, because the minute the parents were notified, they rang the school rang me, and then we got the health protection team involved. So, you know, sometimes you find out from the individual that they've got a positive case, and actually that's a much quicker way. What we're doing at the minute, just to reassure you, is we're busy writing to all our high risk settings. In fact, we're writing to every business in North Tyneside, and we're saying to people, if you're concerned, if you think you might have a case, or you've been notified that you've had somebody through your business who's positive, or you've got more than one case, this is the number for the health protection team. Ring them straight away, and that's what we're doing. So to give you some assurance, we're doing really well in North Tyneside. Could we do better? Yes, of course, we always can. So that's a bit about test and trace. In terms of care homes, when I wrote out to every care home in the borough, I said they could open to visitors if they wished. It was entirely up to them. And we gave them a set of kind of guidelines that they had to work through if they were going to open up. But we made it very clear in the letter that the minute they got one single positive case in either a member of staff or a resident, that we would expect them to close to visitors immediately. So we've been really clear about that. And again, we've got a really good process for tracking outbreaks in care homes. I get notified of every single positive case in North Tyneside. I get the full details, and we get that updated on a very regular basis. So we're able to track everybody who was positive. We know where they live. We're able to map them. We know exactly how many cases we're getting on a daily basis. So I'll pause there and happy to take any questions, Chair.
Thank you very much. Thank you. I've got some other people who want to make some other comments, and that's Willie Samuel.
Thank you, Chair. Really, I was just going back to Phil's report. I mean, there's been a number of bits of government legislation that have come out. Obviously, the one we're all well aware of and spent a lot of time on is the social distancing on the seafront and then Whitley Bay and other other areas as well. But there's bits and pieces, for instance, the relaxation, if you like, of licensing rules, which mean that premises can put seating out on outside on the highway, etc., without actually seeking permission. Have there been many applications for that so far? Because I think I'm aware of one that may be going on as an elected member for an area, but I wasn't getting an awful lot of feedback on what was going on. So do we have a process there so that we can be aware of these kind of restrictions and extensions that are going on? And obviously, the other one is construction sites who can work late, I think up to 9 o'clock or something through the week, when they normally would be 6 or 7 o'clock at night, just to kind of, again, to allow things to be going on. They're probably all quite reasonable ideas in themselves, and they obviously help social distancing. But I just wondered if there's a kind of way that, as elected members, we can be aware of these applications and what's going on before we start getting the complaints from the members of the public.
Yep. Yeah, I can answer that. Just before I do, I can give assurance to Councillor Graham that yes, we will involve members in terms of that formal review of phase 1 before going to phase 2. I didn't want to lose that question that the chair had raised.
I've just had a message from Councillor Rankin, who wants to send his apologies because he can't get logged in before I forget. Sorry, Phil.
Okay.
Yeah, no problem. Yes, we had to put in a process very, very quickly. I don't know if you know a lot about that new Planning and Licensing Act, but it was very much kind of to support the likes of businesses and licensees to have the ability to kind of move to outdoor spaces very, very quickly. It was a fast-track licensing application process. In fact, it said that if the local authority hadn't processed it within 10 working days, it would default to approval. And then it's up to the local authority to kind of do something about that later. We were very proactive with a lot of the businesses that we thought might be interested. We managed to get the process in place. We're getting an awful lot of inquiries about it, but in the first week we've actually only had 5 applications so far, so nothing that's too overwhelming. There are certain restrictions around that. I mean, Cabinet were very, very keen that actually every single outdoor space was a smoke-free zone, which is slightly different to what the national legislation says as well. So we had to make the relevant kind of changes there, but that's totally in line with our public health objectives, and it made Wendy Burke very pleased that we're sending a clear message out that smoking wasn't permitted in these new areas. And there must be the space to do that, which is I think that some of our licensees didn't realise that actually if you spilled out onto a footpath and then there wasn't the space to socially distance as you walk around that wasn't something that had to kind of get approval. One of the differences there is very much is that they're free to spill out into their own space. So car parks, you might see a few tables going in the likes of, but we've reminded all of our licensees actually that if we start to receive kind of noise complaints and likes that we have planning powers to kind of restrict that. So we are trying our hardest. When legislation's kind of passed and you're told you've got a fortnight to do something, you need a process in place. We're trying our hardest to do it in a way that's supporting the business, but it's not becoming a problem for some of our residents and people who live close by as well. And touch wood, to date we've got the balance right at very, very early doors. I'll admit. In terms of the construction, again, there's some new planning legislation kind of being pushed through again. Very much in favour of the developer, so lifting restrictions around kind of working hours, etc., etc. All kinds of new regulations around kind of turning commercial units into residential homes and all kinds of stuff where previously you would have required planning permission, where you won't under the new regulations. You can understand why the government's doing all of this, because it kind of kickstarts economy, gets building work happening, people into work, etc. But again, we're trying to navigate our way around all of these new rules and regulations in a way that we do it so it's controlled and it's not having too much of a detrimental impact on surrounding neighbourhoods. But it's a challenge.
Can I bring just to say as well that we've had Councillor Cox and Councillor Newman join us slightly late from work. Can I bring in Councillor Joe Kerwin, please?
Thank you, Chair. Sorry, I think this one's going back to Wendy now. Just a quick question, or a couple of quick questions around the care homes, and I want to also say that I think we've done a very good job in North Tyneside of supporting a lot of the care homes, both financially and in terms of staff that we've supported them with. So on the occupancy rate, I noticed in the report we talked about a slight increase or a move to return to normal. So the first question is, how close are we to getting back to normal, and how long do we think that would take? And the other questions are around how are we supporting that return to normal, and especially how that might interact with the council's other objectives of supporting people to live independently in their own home. And is there any anticipations that these things are going to come into a bit of a clash or a loggerheads as we go forward?
Thank you, Joe. Joe, I'm going to defer to Mark Longstaff to answer this question, because I think he probably has much more up-to-date information than what I do. It's his area. It's not really mine. Mark, can I hand over to you for that one, please?
You can do, and it's not ticking that, Wendy, is it? Okay. Thank you, Councillor Kerwin. I think in terms of, you'll be aware as to there's been a lot of dialogue, and we've had some really productive conversations with a number of care home providers, certainly over the last 6 or 7 weeks, in probably recognising as to how we've supported them so far by way of grants and passing through very quickly some of the government grants that's come through, as well as some of the direct support in relation to PPE, and indeed some of our staff themselves getting in and supporting care homes. I think it's fair to say a lot of our care homes are feeling the pinch in terms of financial viability and sustainability, just because occupancy rates have fallen to probably just over 80%, probably around the April, May time, but they're starting to move back in the right direction. And I think some of our work with care homes, we've tried to put a package of care and support, both financial and some pragmatic support from colleagues in public health, from adult social care, and from volunteers getting involved in supporting care homes. We watch and we monitor that on a monthly basis in terms of keeping in touch with care homes in terms of occupancy rates, any incidences that we would need to report through to public health, and making sure that actually as to our care homes who support I suppose some of the highest risk residents that we have in North Tyneside feel as if actually it's a bit of a team effort around supporting those appropriately. So working with them very closely, sometimes on a daily, at least a weekly basis. We're gathering information in terms of occupancy rates. Some homes have sustained full occupancy over a particular period. Some have seen a bit of a fall away, and we're trying to compare what it was like last year and what it is currently, and how we can provide some targeted support for some of those homes. And I think we've committed to reviewing that regularly in terms of as we move through different phases of dealing with this emergency, as to how we can provide appropriate support and targeted, so it isn't a one size fits all in terms of what we do. But certainly I've written a number of letters myself, Paul Hanson has, Bryn Roberts has, and other colleagues, just to give them the reassurance about we're listening to some of their concerns, we're trying to deal and support them accordingly, and we'll work with them, I suppose, throughout the course of the year. But I think your other point is also right about what have we learned from some of this, what are the changing dynamics in terms of care in North Tyneside, and how we try and take account as to some of those folk who maybe want some additional support to be at home or in different types of arrangements. I think there's probably a time and a place to go through that in a little bit more detail, but we're just being mindful as to getting the balance right. And I think the challenge at the moment is sustainability of some of our providers and care homes at a time when they're supporting the most vulnerable.
Thank you very much for that. Is that all right, Joe?
Yeah, thank you very much, Mark.
Okay.
Thank you.
Could I bring in Councillor Muriel Green, please, who has a question?
Yes, thank you. I've got several actually, and first of all to say thank you, Phil. It's nice to see you again. I haven't seen you for a long time. There's an awful lot of really very good work going on in North Tyneside, and I think the presentation that you've given us outlines some of that. I've got three questions in particular, and perhaps it refers back to what Mark and Wendy said before. There is an emphasis that people make on care homes as being the only place or the prime place where care actually takes place. And I know it is the most vulnerable, but we also are very conscious in North Tyneside that we've referred to it as care in the community, with the main aim being to keep people in their own homes as long as possible. Now, this means that we've got all the agencies that are involved in social care work, and I just wonder, have they been included in all of this support? Are the social workers that are going in from the agencies, are they getting all the equipment and things that they actually need? Because I think we've got, you're absolutely right, looking at the wider dimension of how we provide for social care. And I really do hope that we can look at it right across the board. The moment we're looking at it, we've got a working group going on. All we seem to be emphasising on is just the adult social care and not the care homes. The care homes are only part of the whole picture. That's one. So if you could just, assure me that they are safe. There's another one that it relates to getting everybody back to work. There's been this mad rush to get everybody back to work, or so it seems. And I just wonder, from this exercise, how much you've learned about the use of technology, or the greater use of technology, to be able to deliver services within the borough and enable more people to actually work from home, because I think that's one of the things that the future holds for us, and it's given a lot of people different opportunities. A lot of people have learned sort of a lot of skills in information technology that they didn't have before. That's the second one. The third one, Phil, is dear to my heart, and you'll have heard it so many times before. The Howden depot is great, and I've heard people going to it fine. We have a waste disposal tip in Brunswick Green, which is 100 yards from the North Tyneside border, and the North Tyneside residents are not allowed to use it. I just wonder if you'd make any progress. It's so much needed, because we're talking about climate change. We haven't lost all the environmental things as well that we should be looking at, and challenging, tackling climate change. But we're actually making people travel from the top end of the borough down to Howden, when really they could be travelling 100 yards over the border and have a tip. I just wondered if any common sense reciprocal arrangement had actually been made for that, please. Right. Thank you very much.
I'll take those in reverse order, because I might ask Mark to kind of pitch in and give and help in terms of kind of what's going on in terms of the support hub. In your first question, in terms of the household waste recycling centre, not really a recovery issue. Obviously, appointment. I know these recycling centres are subsidised from kind of local taxpayers' money. There's no government funding for that. We've talked to Newcastle about that. Our conversations have always kind of hit a brick wall when it comes to we have a different disposal rate than what Newcastle City Council does as well, and the bills they were wanting to charge us, in terms of there is no way of kind of determining the numbers that kind of go there, the tonnage of the weights, etc. And it was never really an affordable option for us to kind of look at. It's something that we keep talking to them about. Unfortunately for us, our waste recycling centre is kind of quite central in the borough, and particularly now with permit schemes, etc., there's not a great deal of abuse. We've eradicated it of people from outside of the borough trying to come in. It would just be an additional cost for us. I'm happy to kind of have another go and revisit it and see if it's something that's affordable, but it would be a substantial cost for the authority to kind of open up, and you'd be paying additional waste disposal costs over and above what you pay for North Tyneside as well. So it's not quite as easy as just saying, could you open the doors? But I'm more than happy to ask the waste team to take another look at that. In terms of the mad rush to get people back to work, I know Boris Johnson's been on telly talking about everybody should be encouraged to get back to work now. Actually, the guidance hasn't changed. Therefore, our guidance hasn't changed. So some of the media stuff doesn't reflect national guidance. We are still very much you work from home if you can. One of our objectives in terms of the recovery framework is, can we build back better? Is there stuff that we're learning that we can bake into the new way we deliver our services? So Jackie Old talks about how the number of business miles that's been saved and how more productive some of our social workers are by being able to do remote interviews. I know doctor surgeries are kind of moving towards some of that. In housing, we're finding we can do an awful lot of the face-to-face interviews that we used to do in offices where people had to travel and it was inconvenient. We can all do that remotely. I know already we're saving something like 1/3 of the business miles and the carbon that's being produced by working remotely. We had an interesting conversation in SLT today about if the virus wasn't there now and a vaccine had been found, what would we return to? There's an awful lot of employees talking about, I quite enjoy working from home now, but actually don't forget we've got to look through the eyes of the customer as well. So I think we're probably heading towards a more blended approach to home and office working. I think that's very much kind of one of the focuses of the next phase of recovery. We're going to have a serious kind of think about what is the end game we're heading for here, and what good things have come as a consequence of kind of like the rapid response to work remotely. We had everybody working from home within about a 2-week period, which was quite remarkable when you look at it now. And we've just done a pulse survey with all of our staff who have been working from home. And they've told us kind of Teams is absolutely fantastic. It kind of it gives me more flexibility in the workplace. Sickness has actually dropped with people working from home as well. So I think, you've got to look back and see what we can build in kind of permanently. In terms of the emphasis on care homes, I get it, and there's been an awful lot of kind of high-profile media attention to this lately. It was when I was referring to, we were making sure kind of PPN went out to care providers. Actually, it wasn't just care homes. It was those care providers we had contracts with. So we were delivering to some of those community-based care facilities. And Mark's still overseeing that kind of that support hub. And whilst the government has kind of withdrawn the support, we are still looking after about 400 people, I think it is, Mark, isn't it, that we are still providing a service, helping those people live within their community.
Yeah, I think that's right, Phil. Muriel, your point's absolutely right and well made in terms of whilst care homes themselves were the focus of a lot of attention, we always recognise in North Tyneside there's a whole, I suppose, community involved in supporting caring needs of individuals. And I've had the privilege of leading up some of our response in relation to our local support system. And at its peak, probably in excess of 1,500 individuals were being contacted on a regular basis just to make sure they had sufficient support to maintain their own independence and living arrangements. And whilst it's down to just over 400 now, I think maintaining that type of support and arrangement, we're starting to see some real benefits, and we're getting some fantastic feedback from residents who are really appreciating the caring nature, the listening nature of members of North Tyneside Council staff and the voluntary community sector as well. So we forged some real strength and partnership around some of that. And as Phil said, it's trying to consider how that forms part of maybe a service offer in the future as well. Yes. So it's just getting the right mix and the right balance to make sure that actually folk continue to be cared for and supported.
And my final point to Councillor Green was, it's lovely to see you too.
Thank you very much. Can I bring in Councillor Allen, please?
Hello, I've got 2 questions. The first one is about the impact of the change in legislation with special educational needs children. And I don't know how many children have been impacted by it or will be impacted, but I just wonder, was there any particular plans for dealing with the gap in assessments and those children that have been identified through that change in legislation. Can you hear me? Hello?
Jim, I can hear you. I don't know.
I can hear you as well, Jim.
Right.
Yes, I can hear you, Jim, as
I
well.
think Phil has frozen. I wonder if could Mark Longstaff answer this question, Chair?
Phil's not frozen, he's just sitting very, very still in case somebody asks him a question. Thank you, Councillor Allen. I probably haven't got sufficient detail to share in the meeting with you, but I know throughout the course of supporting the most vulnerable, then a number of young people and children with special education needs have continued to be supported in some of the special school environment and with some dedicated support. But I think in terms of assessments, education, health and care plans, some of the transport arrangements, there's a lot of work going on to make sure that actually is to, whilst, you know, the majority of children in our mainstream schools, there's a lot of work going in to support those individuals. There's just as much, if not more, going on to support the number of children we have in special school settings and indeed in some of the support arrangements in mainstream schools, particularly around how they're assessed, how their plans are reviewed, how we take account of any change in needs, what sort of additional support we need to put in place to make sure they continue to be safe and secure in an educational setting, and making sure any changing nature of support is picked up and responded to accordingly. But I'm happy to just give you a little bit more of a written response. I can speak to Diane Buckle in the School Improvement Service, Councillor Allen, and get something back to you.
Okay, that's fine. Would you be able to give us kind of the numbers of children that have been impacted by the change?
Yeah, certainly.
Yeah. And also what's the plans for the authority to deal with the legislation not being in existence currently?
Are you talking about the legislation around the review of plans, or the legislation around special education needs transport?
No, I'm talking about special educational need plans.
I think what I'll do, Councillor, is rather than, I suppose, give you an off-the-cuff response, I'll make sure that's included in a briefer note for you.
Okay, that's good. My second question is, are we confident that the schools opening in September, that they're all safe for pupils to attend?
Again, I'm happy for Wendy to contribute to this as well, but we've done a lot of work with all head teachers and all schools to making sure they've done their full risk assessments, they've taken account of what they need to do in terms of working arrangements and space allocations and curriculum support, phase starts, as far as is possible. And we've also got plans in place as to if there is any instances or any outbreaks in any individual schools, as Wendy's already mentioned, as to how we deal with some of that. Certainly Diane Buckle and the School Improvement Team, along with colleagues in Health and Safety, colleagues from our Capital and Investment Team, and colleagues in Public Health, spent a lot of time before the summer break and indeed during the summer break, making sure that all schools are as ready as they can be, based on numbers and based on how they would organise themselves, making sure that actually all schools take their own responsibility for risk assessments and making sure they take some of that individual responsibility where we can advise, support and coordinate. But I think we've done all that is reasonably possible to support schools in making sure that when it comes to the start of the new term, they're ready to receive students.
Okay, thank you.
I think I would just just acknowledge what Mark said, and just add to it really by saying, it can never be risk-free. I think opening any business or school or in any setting, being in the midst of a pandemic, can never be risk-free. I think all we can do is do those risk assessments, put those mitigations in place and support our schools and our staff to operate the schools in the safest way possible. I think the things that the head teachers are putting into place are the right things. They're following the national guidance, and in some ways, I guess we just have to wait and see. The Chief Medical Officer, in his evidence, suggests that actually children are not affected in the same way by coronavirus. So they either don't have any symptoms when they get the virus, or they have a very, very mild illness. It's very different to what we see in adults. So in terms of the risk to pupils, the risk is low in terms of the severity of disease. But of course, what we can't be sure of is whether children and young people transmit and spread the virus in the same way as adults do, and we don't really know about that. So certainly for our teachers, in terms of protecting our teachers, maintaining that social distance, and making sure that we've got really, really good attention to hand hygiene in particular, is really important. And certainly I'm working with Diane and the school improvement team to make sure that we've got good information for schools going back, that we've got good information. They know that got information for parents, so that parents know not to send children to school if they're poorly, and what to do if there's any kind of suspicion of COVID-19 disease in any child. And I think in some ways it's a bit of a waiting game, and I think we just have to wait and see what happens. We don't really know, if we're honest.
Thank you very much. Thank you for that. I think members will agree we've had a really good go at that first item on the agenda, and I think we all look forward to contributing to the review that will be about to happen for this first phase. If members don't have any further questions, can I ask members to note this report?
Agreed.
Thank you from somebody.
Agreed.
We move on to item 6 on the efficiency savings programme for 2021, quarter 1, the progress report on your agenda. And difficult though it is, remember that always in our first quarter that red rags are quite the thing. So I will pass this over to David Dunsford. I think is going to take us through this report, and then I'll ask members if they have any questions and comments at the end. Is that all right? Thank you.
Thank you, Chair. I will share my screen and just go through the report. As you mentioned, Chair, there is a lot of red rag ratings at this stage of the year. This is the first quarter update report of the efficiency savings programme for the financial year 2020-2021. Members will be aware that Council in February 2020, when it set its budget for this year, there was 3.244 million of savings for the year. 3 elements that make up that amount. There's £805,000 of new business cases that were put forward for 2021. Wow. We have a further 1.3 million of business cases that were carried forward from previous years for their impact into 2021. And then there was just over £1 million of business cases which all sit within the HEX Health and Education Service, that were previously achieved by management actions that will require permanent delivery in 2021. As you will obviously expect and be aware, with the current situation we are facing through COVID-19, that has impacted the delivery, or is expected to impact the delivery of some of the savings, especially around the health service and also in commissioning asset management. So on that basis, a lot of the savings are red rag rated at this stage. The current position for the first quarter is that a reverse of 571 is being delivered. Just to explain that, why it's a negative figure. There were 2 savings that were in the budget for 1920 that were one-off savings. So they reverse out into the base budget for 2021. So that is why that figure is a negative 571. That just reflects that those two have been banked and taken into the budget when we started 2021. A further 802,000 is expected to be delivered against the savings targets for this year during the course of 2021, which leaves a balance of just over 3 million still to be achieved at this stage, which finance officers are working with heads of service and their senior management teams to obviously bring that position in balance or as best as we can as the year goes on. In the traditional sort of finance report way, I'll not go through every single saving in detail, but happy to take any questions that members may have on any of the savings within that report.
That's fine. Can I invite members to ask any questions? Anybody got any questions? I mean, the whole impact of COVID on the council's finances, despite any funds given by the government, is quite horrific, and we will see how this plays out. But well, we've had extra costs for things. No questions? And I ask members to note the report.
Agreed.
Thank you so much.
Agreed.
And, thank you. And if members are agreed, we'll move on to item 7, the Technical Services Partnership, the Capital Quarterly Update on pages 47 to 172. Now, you haven't got all of the pages here because it was a massive report, but they were online. And I know there's going to be some screen sharing for those who are presenting the report. And I shall ask Colin MacDonald and Margie Burgess, I think, are going to speak to this report.
Thank you, Chair.
Thank you.
So we've ended up with a lot of papers in one meeting, unfortunately, as you'll have seen, and that's because we're looking at the Q4 and the overall outturn of 1920 and the annual plan for the current year of 2020-21 to come in here. So in the presentation that I've done, I'll cover both of those things. So and then obviously you have all of the background detail to have a look at as well. So I'll just share my screen. Can members see?
Yes, we can see. That's fine. Thank you, Margie.
Okay.
No, I can't. Can you enlarge it?
There.
Yes, thank you.
Is that better? Right. Thank you.
Yes.
So hopefully you'll be able to see. I'll just take you through, as I've said, the outturn for last year. So I'll cover the things that I normally go through, and then the plans for next year and an update on where we are with benchmarking as well, being that we're in a benchmarking year now. So the first area, really just a few things to remind you of really over the course of the year. Some of the things that we successfully did, a lot of it was to do with the sustainable travel schemes. We sent you as a query on one of the previous meetings the report of the Go Smarter schemes in schools that show school runs are healthier, and also we started moving ourselves and other tenants into the building, which is more or less empty now, but we did get moved in before all of this happened. One of the other things that was important that was highlighted for us was improving our customer service. Now we're continuing to do that. We've made some improvements this year, and that's going to continue as an important action plan into next year. So some of the things that we did were improving signage and comms around where we have highway work to explain to people what's going on and give more information on that. And I think that's one thing that's been positively received, and we'll continue to do that. Some of the other things we did, some best practice drop-in sessions, and this was around when we respond to queries, getting people to understand how to use the right language, how to follow up on things. So that's ongoing, but I think the work that Sarah's done started to have a good impact, and will continue into the current year. So moving now to look at some of the value add activities that we always share with you. And I'll just pull out a few examples from here. So one of the good things in last year, in Q4, was that we maintained our Better Health at Work Continuous Excellence Award. And now we're working towards the next stage of that, which is maintaining excellence. Now that's around things like having exercise available for people, we'll have fresh fruit in the office, we'll have ability to help people with certain things, and we've got mental health first aiders in the office now. We've got 15 of those, and so that's something that we've been quite passionate about, and we're continuing to do well with that. We've also continued having work experience pupils in. Obviously, this is until we're starting to do virtual work experience now, which I'll maybe update you on next time when we talk about Q1. But we had 5 pupils in from John Spence, and they spent the day with our building control planning and public protection teams, and they had a great day. And I think a lot of them are saying that they're very keen to look for a career in the kind of things that we do. We've also started work on a book buddy literacy programme with Percy Main School, and we ran a business breakfast at Norham School, and that was the first one that they'd ever done, and that was about getting local employers in to support the school and looking at pathways into employment. We also did we did a range of employability events at those schools that you can see there. So it was a busy quarter actually, right up until March. Another thing I wanted to talk to you about this time, I've spoke to you a few times about our commitment really for supporting girls at school getting into employment, particularly girls getting into engineering. And this is a new initiative that we've had this year, working with what's called the Girls Network. Now they work really hard to help girls to overcome barriers that they might have, and that we match them up with mentors. So we've got four girls at George Stephenson High School who are 15, and we've identified 4 female mentors amongst our ladies in the team, and they have mentoring meetings with them so that they've got somebody to chat to about their career aspirations, to talk about how things work for them. And I think this is really important because at this time, some of the work that the Girls Network's done has shown that the impact of COVID on girls has shown that a lot of them are worried about their future and reporting a deterioration in mental health, etc. So this is something that we've started and it's gone really, really well. And so we're going to continue with this and step it up next year, because 96% of the mentees that have been through the programme have said that they came out of it feeling more positive about the future. So that's great. That's something that we've been really, really pleased about. Talking about our other Schedule 10 commitments that we deliver, this is really just the summary for Q4 that we share with you. So we've hit all of our targets for having graduates, apprentices and work placements, where we've actually got currently 24 apprentices in place, which is more than we've ever had. We're continuing to do good work with the Business Forum and supporting local SMEs and charities. And also David Dalglish continues on the Armed Forces Forum as well. We've launched a military employee network group, and that's to encourage staff to share their story or learn from colleagues who've come in from serving from the armed forces. And for some jobs, particularly those in car park enforcement, etc., we've had some really good success stories in that area too. So moving on to the people update, again, a lot of good movements in Q4. We had a lot of staff getting and securing their qualifications in professional membership in engineering, and ICE Quest technician scholarships went to two of our staff, project manager accreditations, and we've had some people now promoted. Sam Berry and Pamela McGorry both got promoted in Q4, and a lady in our property teams just started a new apprenticeship on accountancy. So again, 5 new starters, one of which being a new post that's additional. I mentioned this to you last time, I think. So this was an example of where we had a job for a professional health and safety advisor, but what we did, rather than advertise and get somebody in who was already qualified, we advertised for somebody who was already on our apprentice scheme, so they've already been through training. And Catherine's took up this role, and we're now putting her through the training to become qualified. So that's a really good thing, because one of the things that came out in our staff survey was that we had to be clear on career prospects for people, that they went through a certain level of training, but then they needed to see what was going to come after that. So it was really about retention of people that were put through training, and that was a good example to share with you. The example I was going to give you this year, this time for the case studies, was on graduates. I don't think you might have got the booklet because I think there was too many attachments, but I'll separately make sure that you get sent that. So we've shared with you apprentices. You've got graduates this time, and next time I'll share with you something about our work experience, and you can have a look at that offline. I also just wanted to talk about some of the COVID support that we've been doing, because obviously when things change radically, a lot of our teams stopped doing the work that they were doing and made themselves available to do the work that was of more priority to the council. So these are just a few examples, really. The highways teams were involved in supporting all of the car park closures and opening again, putting all of the signage in place. Joanne Lee on our regulatory services side has been heavily involved in supporting the council with everything really to do with all of the COVID issues and the new legislation. Property teams have been working with tenants, and similarly we've been helping with on traffic management side. So this was just to say really that we've done everything that we've been asked to do in supporting the council, and moved our priorities really quickly in line with what we were needed to do. This is where I get into the detail with you now on last year's performance. So as always, there's information on the overall KPIs that we have, and then going through each of the 3 areas of property, regulatory services and engineering. So I'll take you through it, and then if there's any questions at the end. So now we've got the performance for the whole year, so every quarter shown together. So all of these were green, and these are the cross-cutting KPIs, which are across all of the services that are set every year. So these were all achieved. Some of them come back in next year because we're developing further, and some of them for next year will be completely new. Looking at property, you'll see at the end on here Prop 7 and Prop 8, and you'll see when we get to the KPIs as well. Members will remember that we transferred back the maintenance service, the asset service that did building maintenance, transferred back to the council in Q4. So that's why there's no performance report for those services, because they weren't run by Capita. by capita anymore. So Q4 was green on all of the property action plans. Looking at the KPIs again, and you'll see they've gone down. There's only 2, so we have built more in for next year, and that's because those 2 went back into the council. On category 1, the only one that we don't have the result for at the time was the Strategic Property Customer Satisfaction Survey, and so we'll report that back in once the results are available. Moving on to engineering, these are the action plans, and you'll see that the one that's amber, and this was because we were going to do a postcard survey, and then it was decided that it would be better in discussion with the council to do it in 2020-21, but do it in line with the council's Murray survey, so that we didn't do something separate. So that's why that one's been deferred into the current year. Looking at the engineering KPIs, now you'll see some yellows in March, and that was because really toward the end of March, when people weren't able to do things due to COVID, some of there was obviously a dropout off in performance in both of those KPIs. Everything else was green for engineering in Q4. If we look at regulatory services again, there was a slippage in one of these in Q1, and that's been made up and corrected towards the end of the year for everything else to come in on target for the action plans. The KPIs, which spread onto 2, because regulatory obviously covers planning and building control and public protection. So these ones are all at green. And in the category 1 PIs, the one that's amber and the one that's red, and we've discussed this in here. This is something which is the subject of a more detailed review by the subcommittee. The subgroup is taking an action to come up with a detailed dashboard that we can report back on, looking specifically at lessons learned and any changes in process that might need to be made to try and improve these statistics. So that was a look back at the previous year. So now we've just finished Q1 of the current year, and we've got our annual service plan, which has been shared with you, and we've been monitoring our Q1 against this plan, and that'll be reported into the next meeting. But I do just want to let you know that we've been asked, and we're in the process of revising the annual service plan, because obviously between doing that a lot changed in terms of priorities and in terms of how cabinet agreed that the council was gonna prioritise things for the rest of the year. So we've been asked to review this plan and make sure that we align with the council's two periods that are going to follow up. So we're in the process. We've almost finished that, and once we've done that, we'll reshare the plan. So what it'll do, it'll bring in some COVID related targets where the council wants us to focus on, and it'll, rather than having quarter 1, 2, 3, 4, it'll have period 2 and period 3 to line up with the way the council's now monitoring. But some of the things that are in there are set out in the contract, and they're in there, and they'll be unchanged. And that includes we've worked with colleagues and we've reviewed all of the KPIs, all of the action plans, and we've reset those for the current year. And also we've got all of our other contract commitments there that are set out on the other side. And those carry forward. So this year, for example, we've got our savings target through business cases and service improvements, and we've got our investment target of just over 2 million in line with council's priority themes. So all of those things won't be changed. It'll just be the more specific targets that'll be revised. finally, this is just really for your reference to know who now is the partnership team and how many employees we've got. And I'm sure as we go through the year and we focus on some of the specific services, you'll get to meet the various heads of service. So the final thing to update you on is benchmarking. So basically, we are in a benchmarking year, and we've identified that there are some issues with benchmarking due to the timing for people having submitted their data into use, and just availability of us being able to ask for benchmarking information. However, we're working on a detailed plan as to how we can, within those constraints, make sure we still comply with the benchmarking requirement, the benchmarking will take place between November and March. So the idea is that we'll redo what we were planning to do, taking into account the constraints, and we'll get that approved through our strategic partnership board, and then it'll come back into this committee before we start the work in November. So that was my presentation, Chair. The finance annex is to be done separately. I'll just try and unshare my screen.
Yeah. Thank you very much. Thank you. Can I ask members have any questions? No, I just had one myself, Margie, and that's to do with on page 75, prop 1.3, on the percentage of properties let from the council's commercial portfolio. Just wondered why the PI is quite low at 70%. Minimum is 70%. We've got quite a lot of properties lying around that are in the council's ownership that aren't let, and it's probably not the best time now to let them.
No, you're absolutely right. So we've got some property might need work done to it, so there might be some repairs and maintenance that might mean at that point in time it can't be let until it's been fixed. So a couple of the industrial units are in that place. Others of them might be in a regeneration zone where they will eventually be let, but there's other things to happen. So the target's usually set in line with what we would think to be rentable at the point in time, and obviously the team do work hard, and we're challenged to make sure we can get any that are rented to be rented. But there's usually just a proportion of them that are that are ready and able, and they can turn over very quickly, and others that need work, and there might be a bit of a time delay between that. I don't know, Mark Longstaff might want to add to something on there, but it is important to us to get as many that can be rented in as quick as we can.
There's probably nothing to add, Margie, to the summary that you've given in terms of making sure actually we're as efficient as possible in terms of turning around properties and buildings that there's a demand for, but it's also been making sure that actually if there's any work done, or indeed a lack of demand in one or two areas, that actually we make the right choices. But I think the response, Margie, is fine in terms of between ourselves as to how we're giving some appropriate consideration to our portfolio of buildings and rentable properties and making the right choices.
Okay, thank you. Does anybody else have any comments or any questions? No? Can I ask members to note the report?
Agreed.
Thank you. And before we proceed to the final part of the meeting, can I thank officers and any members of the public that are at the other end watching this live stream. And the next Overview, Scrutiny and Policy Development Committee will be held at 6 o'clock on the 7th of September.
Thank you.
We look forward to welcoming you there. And could we ask members to turn on your microphones and request members to agree to pass the exclusion resolution for agenda item 9.
Agreed.
Great.
It contains exempt information, and the live stream will now be switched off to enable a final item of business to be concluded in private.